specialized foster care. Today's training will be slightly unique in that today we will be training you not only on the billing and claims and enrollment portion, but also the policy as well as the eligibility criteria and the process. And so joining us today will be the Division of Child and Family Services, as well as our fiscal agent, Gainwell Technologies. You will hear first from Mackenzie Lord from Gainwell Technologies. And then secondly, you will hear from Sarah Dearborn from the Division of Healthcare Financing and Policy. And then finally, you'll hear from Dr. Freeman from the Division of Child and Family Services.
Hello, everybody. My name is Mackenzie Lord, and I'm going to be going over some basic enrollment and claim submission questions regarding provider type 86. First things first here, we're going to talk about provider enrollment. So if you go to our public Medicaid website, which is medicaid.nv.gov, there's a dark blue toolbar at the top of that screen. You can hover over providers, and then you can choose the provider enrollment option from that drop-down menu. That's going to take you to the screen that you see on the slide here, and that will lead you to a ton of helpful information regarding provider enrollment. We've got a link here for the online provider enrollment tool, which is what you're going to use when you are ready to submit that application. We have a information booklet that will provide just general information for all provider types. We have our enrollment checklist, which we will touch on specifically for this provider type in just a second. And then we also have a bunch of training materials, which will walk you through step by step the enrollment submission process if you have any questions once you get to that point. It is important to keep in mind when you are enrolling as a provider type 86, for those of you who are already enrolled with Nevada Medicaid, you will need to obtain a new NPI before you can submit this new enrollment. Like I was just mentioning, we do have our enrollment checklists for each of our provider types, and this is going to tell you what it is that you need to submit with your enrollment application. So for provider type 86 specifically, we need documentation of your tax ID. That can be the SS4, your W-9, whatever documentation that you have. We need the signed agreement between the Specialized Foster Care Agency and Licensing Authority, and that is defined in NRS if you need more information on that one. We also need a copy of your Secretary of State business license. For any provider who is out of state and out of our catchment areas, you would need to submit proof of Medicaid enrollment in your home state. We also need proof of the NPI, provider's name, again, proof of that tax ID, a voided check or a bank letter for your EFT information, and then a letter of intent, and that can include recipient information or just why you want to be enrolled with Nevada Medicaid if you are out of state provider. Next, we're going to talk about the online provider enrollment tool. So like I said, on that provider enrollment link, there is a hyperlink there that will take you to this enrollment tool. To start that application, you can go ahead and click on Provider Enrollment Application from the top corner here. Like I said, if you are interested in enrolling as a provider type 86, you will need to obtain a new NPI from what you already have. Once you go through the provider enrollment process and you're ready to start submitting some claims, we also have a bunch of resources regarding billing information. So again, from that public website, medicaid.nv.gov, once again, you're going to hover over providers. This time, instead of provider enrollment, you're going to select billing information, and that will take you to all of your billing resources. First, we have COVID-19 billing guidelines, so we do have specific information regarding COVID. Below that, we have remittance advice reference materials, which will provide you explanations on our error codes. It will provide you financial reason codes and all the different codes that you might see on your remittance advice. Below that, we have our billing manual, which is going to provide general information, again, for all provider types. And that's going to include different information from prior authorizations, checking eligibility, submitting claims. And then below that, we have billing guidelines that are specific to the provider type. For your provider type 86, this is going to include covered and non-covered services, the codes that you're allowed to bill for, It's going to go over your service limitations for each code, prior authorization requirements, what chapter of policy you should be looking at, and really everything that you need to know regarding this provider type. So once you have your new MPI and your application has been approved, you are ready to log into the EVS system. So for our specialty foster care, all of these claims do need to be submitted through the EVS portal. And since all of these providers have a new NPI, even if you have logged into the EVS portal previously, you will need to create a new initial login under this provider NPI. So if you're not familiar with registering for an EVS user account, you can select the Register Now link, and that will take you through step by step to get yourself registered. If you have any questions, we do have an EVS user manual also available on our Medicaid website that will walk you through the process of getting started and registering for a user account. Again, this is what that EVS user manual is going to look like. Chapter 1 specifically is going to talk to you about getting started with that EVS user account. It'll talk about the initial registration process as well as assigning any delegates if you have any people that are going to be performing any tasks on your behalf. We also recommend reviewing Chapter 3, which will go over step by step the claim submission process through the EVS portal. Once you're ready to submit claims, you are logged into the EVS portal. Under that top dark blue toolbar, you're going to hover over the Claims tab. And for provider type 86, you're going to want to submit claims professional. So you all are going to submit professional claims. And then the claim submission process is broken out into 3 different steps. So step 1 is going to be on the first page, and that's going to include your provider information, the patient information, and any claim information. You'll also have the option here to add any other insurance details. You'll continue into step 2, which will include any diagnosis codes. And then when you continue onto that, you'll get into step 3, which is going to go over the service details and any attachments. I do want to point out here that you will be required to attach the eligibility checklist to the initial claim submission for each recipient, and then you'll have to resubmit that every year afterwards. And if you are interested in any additional training or need any additional resources, we do have tons of information available for you. Again, that public Medicaid website, medicaid.nv.gov. We also have the DHCFP website, which is dhcfp.nv.gov. Several different web pages available on our website that can help you out. We talked about the provider enrollment page. We talked about those enrollment checklists, and then we talked about the billing information. So these are just the links to get there. And then if all else fails and you have any additional questions for Nevada Medicaid, you can always contact us. Our customer service phone number is 877-638-3472. We do have a line dedicated to prior authorizations, which is 800-525-2395. And then we have our team of field representatives. If you do need any one-on-one training, you can always send an email to nevadaprovidertraining@dxc.com. Do make sure that you include your NPI in that request, and we'll get you over to the right field representative to help with some additional training. Thank you.
Thank you, Mackenzie. My name is Sarah Dearborn, and I am a Social Services Program Specialist within the Behavioral Health Unit at the Division of Healthcare Financing and Policy. For reference for specialized foster care services, please reference Medicaid Services Manual, Chapter 4000, 1915I, Home and Community-Based Services, State Plan Option for Intensive In-Home Supports and Services, and Crisis Stabilization Services. The program eligibility for these services is determined by a couple variables. A youth must meet and maintain Medicaid eligibility in order for reimbursement from Medicaid. A youth must be under 19 years of age at the time of enrollment. They may continue in home and community-based benefit through the age of 19. A youth must have a DSM-5 diagnosis or a DC-0-3 diagnosis. A youth must meet the needs-based eligibility requirements, and I'll discuss this on the following slide. And then the youth must reside in the Nevada licensed specialized foster home based setting, which is not considered an institutional level setting. This slide shows the example of the needs-based eligibility checklist that will be required to be completed by the youth's designated care coordinator. The care coordinator would be the caseworker that is with your local county child welfare agencies, or perhaps with a care manager or wraparound facilitator within the Division of Child and Family Services. This eligibility checklist would need to be completed to determine the youth eligible for these 1915I home and community-based services for specialized foster care. Once this checklist is completed and signed off by the care coordinator, that care coordinator will provide this checklist to the specialized foster care agency. So then at that time, the specialized foster care agency knows that that youth can be, so that youth can have intensive in-home supports and services and or crisis stabilization services and be reimbursed for those. This checklist will be submitted with the initial claim for those services and then annually thereafter. There are two services within specialized foster care that are reimbursable from Medicaid. These services are intensive in-home supports and services and crisis stabilization services. Intensive in-home supports and services include evidence-based interventions that target emotional, cognitive, and behavioral functioning within a variety of actual and/or simulated social settings. Activities and environments are designed to foster the acquisition of skills, building positive social behavior and interpersonal competence. Services focus on enabling the participant to attain or maintain his or her maximum potential and shall be coordinated with needed behavioral and physical health services and supports in the participant's person-centered services and support plans. Regular support and technical assistance to the treatment parents in their implementation of the plan of care and with regard to responsibilities they undertake. The fundamental components of technical assistance are the design or revision of in-home treatment strategies, including proactive goal setting and planning, the provision of ongoing child-specific skills, training, and problem solving during home visits. Also, assessing behavioral problems and the functions of these problems and related skill deficits and assets, including identifying primary and other important caregiver skill deficits and assets related to the youth's behaviors and the interactions that motivate, maintain, or improve behavior. Intensive in-home supports and services may serve to reinforce skills, behaviors, or lessons taught through other services. Also, there's crisis stabilization services. These services include short-term, outcome-oriented, and of higher intensity than other behavioral interventions that are designed to provide interventions focused on developing effective behavioral management strategies to secure participant and family caregivers' health and safety following a crisis. These services may only be delivered in an individual one-to-one session and are available in the child's home. The service is designed to be short-term and to achieve community stabilization through psychoeducation, crisis stabilization, and crisis resolution support. The service is of high intensity with the intent to develop effective behavioral strategies that will be maintained and help the child to sustain the behavioral strategies long-term. When it comes time to bill for these services, the following limits apply to intensive in-home supports and services. So when a specialized foster care agency is going to bill for these services, they would utilize HCPCS code H2019 for the intensive in-home services and supports without coaching. This service is provided in the home by the treatment foster parents. These services have a maximum of 2 hours per day and are provided 7 days a week. Additionally, providers can utilize HCPCS code H2019 along with modifier HT for intensive in-home services and supports with coaching. This is also provided in the home by a trained coach, typically from the specialized foster care agency, supporting the treatment foster parents to deliver evidence-based interventions to fidelity. There is a maximum of 1 hour per week for this service. The following service limits apply to crisis stabilization services. Please utilize HCPCS code S9482 when billing for crisis stabilization services. The maximum number of these services is 4 hours a day and up to 40 hours per month. I will hand it on over to Dr. Freeman to discuss program eligibility and quality assurance. Thank you for your time.
Hello, everybody. I'm Dr. Freeman from the Division of Child and Family Services. I'm going to talk a little bit now about flow through the eligibility process, as well as documentation and the QA process. So once a youth is admitted to specialized foster care, which will continue to happen along whatever procedures are usual for the child welfare jurisdiction, the youth care coordinator will review their existing records in order to determine if they are eligible for the 1959 services. The care coordinator can be either a caseworker at the child welfare jurisdiction, or if the youth is placed in an AFC home, or if they are a rural child welfare youth, the care coordinator will be a DCFS WIN worker. The review of records must consist of, at minimum, a review of the CASI-EXI, the SED determination, and the diagnosis. The care coordinator will fill out the eligibility checklist to confirm that the youth is eligible for services. If the youth is placed in an agency home, the care coordinator will then provide confirmation to the agency that the youth is eligible and the services may be billed. If the care coordinator is a WIN worker, WIN will communicate regarding eligibility to the child welfare jurisdiction. Once eligibility is established with the eligibility checklist, the checklist is provided to Nevada Medicaid. As I said before, the care coordinator is responsible for filling out the eligibility checklist. Once the youth is receiving services, the service provider must complete a progress note each time the service is delivered. And the requirements for progress notes are described in Chapter 4000. Now I will talk a little bit about the plan of care. For all youth receiving 1959 services, a plan of care is required that documents which 1959 services are medically necessary and why. It is not necessary to submit plan of care documentation in order to access the 1959 services. However, the plan of care will be used for quality assurance in order to ensure that the requirements of the 1959 as we submitted it to CMS are being followed. DCFS Planning and Evaluation will review 10% of plans of care for all youth receiving 1959 services. Whenever possible, we will review existing documentation in Unity or MyAvatar so that additional paperwork does not need to be submitted. We are working now with child welfare jurisdiction staff to ensure that we're looking for the right information in the right places. So in accordance with Chapter 4000, the plan of care should be developed using a person-centered planning process, and it should promote the involvement of the youth and the parent. The development of the plan should focus on a strengths and needs-driven approach. And the plan should be based on an assessment of a number of different domains, which you can see on the screen here. Chapter 4000 requires that the plan include needs, outcomes, and strategies, and those must be specific, measurable, and achievable. Additionally, the plan of care must include detailed service plans for the applicable 1959 services. So that would be intensive in-home services such as Together Facing the Challenge and crisis stabilization services. When conducting quality assurance reviews, planning and evaluation will look to ensure that the plans meet the criteria set forth in Chapter 4000. We will check to see if the plan includes needs, outcomes, and strategies, and whether these are specific, measurable, and achievable. The 1915I Quality Improvement Plan also requires that we ensure that the plan adequately addresses the needs of the youth, and we must check to see that plans of care are updated every 12 months. Additionally, the 1915I requires that participants are given a choice when selecting providers or services, and we are working with the child welfare jurisdictions on how best to document this with a child welfare population. Other important pieces of the 1915I Quality Improvement Plan are that the individual must meet needs-based eligibility criteria prior to receiving services. Periodic audits may be conducted to ensure that this is not a concern. And finally, the 1959 Quality Improvement Plan, as we submitted it to CMS, requires that the state identify, address, and seek to prevent incidents of abuse, neglect, and exploitation. If such an event does occur, the incident must be reviewed and a plan of prevention must be developed and documented. For quality assurance purposes, we will periodically check to see if incidents meeting this criteria have occurred, and we will do a brief review of the incident to ensure that it was addressed and documented. In any situation in which there is a concern identified through the quality assurance process, DCFS and DHCFP are required to remediate issues or noncompliance within 30 days. Plans of correction may be issued if concerns cannot be immediately addressed. So that is all I have for clinical flow, documentation, and quality assurance. Thank you for watching our training today. If you do find that you have any questions following this training, please contact Sarah Dearborn with the Division of Healthcare Financing and Policy. Thank you.